Assalamu alaikum. I am Dr. Mohammad Tawfiq Hassan Khan. Today we will dissect superior and inferior extremities. At first, I will make a curved incision along the anterior axillary fold, and laterally to the arm for about 2.5 inches. Along the axillary fold, anterior axillary fold, and laterally 2.5 inches. And this incision starts from the level, this is the nipple, from the level of the nipple. Then I'll make my second incision. It's a vertical incision from the medial end. This is the medial end. From the medial end of my first incision to the posterior axillary fold. Medial end of my first incision to posterior axillary fold, a vertical incision. Then I'll make another vertical incision from the lateral end. This is the lateral end of my first incision. From the lateral end of my first incision, I'll make another vertical incision to the posterior border of the arm. And then reflect the skin and superficial fascia laterally. And this is the axillary artery, and this is the axillary vein. We know about the medial cord, lateral cord, and posterior cord of brachial plexus. Here is the medial cord and lateral cord, and here is the posterior cord. At first, I'll make a transverse incision in front of the elbow joint, and connecting in front of the elbow joint and connecting two humeral epicondyles. This is the lateral and this is the medial. Two humeral epicondyles in front of the two humeral epicondyles. A transverse incision in front of the elbow joint connecting the two humeral epicondyles. Another transverse incision at the junction. I'll make another transverse incision at the junction of the upper 1/3 with the lower 2/3 of the front of the forearm. A transverse incision at the junction of the upper 1/3 and lower 2/3 of the front of the forearm. Then finally, I'll make a longitudinal incision joining the midpoints of the transverse incisions, midpoint of the transverse incisions. This is gluteus maximus and this is gluteus medius. This is a sciatic nerve, and this is the sciatic nerve, and close to the upper angle of the popliteal fossa, it divides into common peroneal and tibial nerve. At first, I'll make an oblique incision from the anterior superior iliac spine along the inguinal ligament to top of the pubic symphysis, along the inguinal ligament to the from anterior superior iliac spine along the inguinal ligament to the top of the symphysis pubis. Then I will make a transverse incision at the junction of the upper 1/3 and lower 2/3 of the front of the thigh. A transverse incision at the junction of upper 1/3 and lower 2/3 of the front of the thigh. Then I will make a longitudinal incision joining the medial ends of the first and second incision along the medial side of the thigh. Joining the medial ends of the first and second incision along the medial side of the thigh, and reflect the skin laterally. This is femoral nerve. This is femoral artery, a thick luminous structure compared to femoral vein, and this is the femoral vein. This is rectus femoris, and behind this muscle this is vastus intermedius. Medially it is vastus medialis, and laterally it is vastus lateralis. This is sartorius. This is iliotibial tract, this shiny structure, and this is a thickened band of fascia. This is biceps femoris. This is biceps femoris, and this is semitendinosus. This is semimembranosus, semimembranosus, semitendinosus, and this is biceps. Now this is the back of the thigh, and I'll make a transverse incision. Transverse incision at the junction of upper 2/3 and lower 1/3 of the back of the thigh. This is the back of the leg, and I'll make another transverse incision. A transverse incision at the junction of upper 4th and lower 3/4. Lower 3/4 of the back of the leg, upper 4th and lower 3/4. A transverse incision, and finally I'll make a longitudinal incision. A longitudinal incision joining the midpoints of the first and second incision and reflect the skin on either side. This is the boundary of popliteal fossa. Above and laterally it is formed by the tendon of biceps femoris, and above and medially it is formed by the semitendinosus and semimembranosus, and below and laterally this is the lateral head of gastrocnemius, and below and medially this is the medial head of gastrocnemius. Above the popliteal fossa, the sciatic nerve divides into two terminal nerves. This is column peroneal, and this is tibial nerve. This is popliteal artery. This is the popliteal artery, and this is the popliteal vein. This is tibialis anterior, and the muscle fibers converge below into a central tendon. This is extensor digitorum longus, splits into 4 digital slips for insertion into lateral foretoes. This is gastrocnemius. This is soleus, and blends with the tendon of the gastrocnemius form tendocalcaneus or tendoachilles.